All right, so we're basically going to crunch everything here in about 3 weeks, the skull and facial bones. There are a couple schools out there that cover this part of the anatomy for an entire semester. So we're going to do it in 3 weeks. We don't spend a lot of time on it because most of the studies now are going to be, they're conducted either CT or MRI. We still do some aspects of skull and facial x-rays, but it's only good when you're looking at the exterior part of it. It's a lot harder to see the inside part of the anatomy because the bone is so dense and because they're so small. That's where CT comes into play. So again, we'll do this in 3 weeks. The skull is the bony skeleton of the head. We're going to break this down into 2 different sections. Today we're going to cover the cranium, and then the next couple of weeks we'll talk about the facial bones. So the cranium consists of 8 bones, whereas the facial bones consist of 14 bones. The skull is one of those difficult type of procedures to do because, again, of its complexity. There's a lot of parts to it, and there's a lot of angles. You will see, again, that when we talk about positioning, it's not only about angling the tube, but now it's all about angling, rotating your head at certain degrees, tilting your head at certain degrees. So instead of maybe 1 or 2 angles, now we're dealing with 3 angles. Okay? So, let me see, frontal and lateral views of the 8 cranial bones. So the 8 cranial bones, we have the frontal, 2 parietals, 2 temporals, we've got the occipital, ethmoid, and then the sphenoid bone. The skull cap is also termed the bony calvaria, And that would include your frontal bone, your parietal, and then your occipital bone. And then we're also going to include here, it says AB, where's B over there? A, what? Am I missing something here?
Which you look at the left or profile?
Well,
the left one has B.
B and
but
C are both parietal bones, that's why.
B and C the same.
And it's turned that way, that's why I don't see B.
Okay, so yeah, so it's the frontal, the 2 parietals, and occipital. Why did they do that? So B and C are the same bones. Okay. All right, so that's the bony calvaria or the skull cap. Let's see here. Identify the 4 bones making up the floor of the cranium. So now we're talking about the floor of the cranium. That was the skull cap we were referring to the other one. Now let's talk about the base or the floor. The base of the floor is going to be formed by, let's see here. So we're looking at this from inferior up. We have the ethmoid, which is E. Sphenoid, which is F. We got the temporal bones, which is H. I think they match over here. Ethmoid, okay, E, F, yeah, so they match over here. So that would be your 2 temporals, 1 sphenoid, and 1 ethmoid. Okay, so we're going to break this down into the different bones. The first one here is the frontal bone. The frontal bone forms the forehead or the squamous or vertical portion, and it also forms the superior part of the orbits. There are different identifiable landmarks of the forehead that you guys need to be familiar with because we use this as landmarks to position the skull. The first one is the glabella. So if you run your fingers down the middle of your head, okay, you can see, you can feel a small indentation, and then it protrudes, so it dips and then it sticks out. You guys feel that? It dips and then it sticks out. So right around the level of your eyebrows is the glabella. We use that as a major landmark.
I don't have it.
You don't have one?
No, it's gone.
And then the superciliary ridge or the arch, that's essentially that bony protrusion right where your eyebrows are. The supraorbital margin, also known as the ridge, is again just right at the very edge underneath your eyebrow. Okay, so that's the supraorbital ridge, but we also, supraorbital margin, but we also call that the ridge of the orbit. Then we have the supraorbital groove. Supraorbital groove. And again, if you take your hand, okay, and then you can feel that dip. That dip there is the groove. Wish I had my camera. You guys are all doing it. Okay, so that's the groove. And then the frontal tuberosity is that pointy bone right there on your forehead. It's a protuberance. There's no missing it. It's a point.
I miss.
Okay. You don't have one either. Okay. Okay. Which four bones articulate with the frontal bone? We have two parietals, the sphenoid, and then the ethmoid bone. So again, the ethmoid bone is not one that you can see from the outside. It's located in the inside. Okay. Now let's look at the orbital or the horizontal portion of the frontal bone, and so this is essentially what it's doing. So let's take a look at this. So what we're doing here is we're just simply, if we isolate that, highlight others, we're looking at this particular picture like this. So we're looking at it underneath. Okay? So on the most anterior part, you're going to see the frontal tuberosity, again, that's a pony projection on your forehead. Then we have the glabella. Remember, the glabella is that protrusion in between your eyebrows. And then we have the superciliary, the ridge or the arch, and then the supraorbital margin. And then we have a space here that allows for the bony nasal septum, which is going to be covered on the facial part of it. And then there's a little notch there that will allow for the articulation with the ethmoid bone that we'll cover in the next few slides. Okay. All right, the parietal and the occipital bones. So let's see what we have here. So on the parietal side, there is also an eminence. If you feel the side of your head, there is another bony projection on the side of your head. That is the parietal eminence. We use that to measure from eminence to eminence the thickness or the width of your skull. Okay, so the eminence is going to be the furthest out on either side. We have two parietal bones. One is the left, one is the right, separated by the sagittal suture. We'll talk about the sutures later on. It's also, the parietals are also going to communicate with not only the frontal bone in the front, but the occipital bone on the side. We also have, it's also going to articulate with the temporal bone as well as the sphenoid. And then the occipital is going to be the back of your head. It too has a protuberance, bony projection, again, right in the back of your head, right before you hit that soft spot of your neck. The occipital bone not only articulates with the cranium and also the temporal, but it's also going to articulate with the first cervical spine. What is this first cervical spine called?
Axis?
The atlas. Okay, so what's going, the atlas. You guys remember Atlas, the one holding up the globe? Okay, you know what I'm talking about?
Don't know.
Atlas is named after, is it a god? Yeah. Yeah, Atlas. Okay.
Now I feel embarrassed.
Yeah, so so Atlas then, the Atlas then is going to be the one supporting the occipital bone or your entire skull. Thank you.
How it goes?
I didn't get it.
Did you get it? All right, any questions about the parietal and the occipital? All right, so here we isolated the occipital bone. On the very bottom of the bone there is the protuberance. We're also going to call that the inion. The inion. The major part of the occipital bone is the squamous portion. Squamous just means flat. Okay, so the very flat surface of your occipital bone is the majority of your occip. And then right in the bottom of that, you've got your condylar or smooth portions on the base of the skull, and this is what forms the occipital atlanto joint. Again, occipital of your cranium, and the atlantal referring to C1. And the large hole right in the middle is known as the foramen magnum. What goes through there? Your what? Everyone's mumbling. Nobody wants to really say what it is. What goes through there? The spinal cord? Okay. All right, the temporal bone. The temporal bone also has a squamous or flat portion. There you would find the external auditory meatus. Here it says external acoustic meatus. It's both. You can say auditory or acoustic. We'll just say EAM for short. That is an important landmark that we use for positioning the skull. It's that EAM. Right off of the squamous portion and right off the EAM is a projection, if you will. It's the zygomatic process. This portion right here, zygomatic process of the temporal bone. And when it articulates with the zygoma of the facial bone, it forms the zygomatic arch. It forms an arch. Inferior, we have the styloid process. Right behind the styloid process is the mastoid process. And again, that's something that you can feel right underneath your ear. The mastoid portion of the temporal bone has air cells. Air cells is what helps keep your head light. So that's the mastoid portion. If you get an infection, you get a terrible headache right on the back. We'll talk about how you can get an infection in your mastoids later on. But when we used to do mastoid x-rays back in the day. And they're simply 4 to 6 projections total. But they weren't often done. So it took anybody who never did the studies, it took them anywhere between 3 to 4 hours to do, because they could never position them correctly, and they were constantly repeating it until they got the right projection, the right views. 3 to 4 hours. Can you imagine all the X-rays that they're getting around the eyes, around the throat?
Yeah, they came with one thing and then
So,
left us.
Yeah, so what I did is, I actually took a phantom skull, and I developed a way in which we can expedite that process. It's so sad because I don't have it anymore, but I lost all my notes on that. But we were able to do it in less than an hour after I was able to show them alternate views of how to do it, and I lost it. And it didn't matter because we do mastoids now under CT. So it wouldn't have mattered anyway. But it would have been nice to have my name attached to it. The Free Neza view. Or All right, so we're still talking about the temporal bone. The temporal bone is an important bone because it houses the organs of hearing and also balance. The temporal bone is important because it houses the organs of hearing and balance. So there's an area in the temporal bone, we call it the petrous portion, and then you see the alternate names. It's also known as the petrous pyramid, the pars petrosa, or the petromastoid portion. Depends on what you're reading. They're all mean the same thing. but we refer to it as the petrous portion. On the very superior part of this portion is a jagged edge, and we call that the petrous ridge that we use in critiquing our images, analyzing our images to make sure that we have the proper position. So we look at these petrous ridges in a majority of our skull studies. Okay? All right, let's keep on going. So again, you can look at the three parts. You've got the squamous portion, which is the flat part, the mastoid portion, which contains the air cells, and then the petrous portion. And here is an infero-superior view of the temporal bone. Let's see here, right side. So there we have again the petrous pyramids or the pars petrosa. And this is where you're going to find this canal right here. This is the internal acoustic meatus, or that's the inner ear, IAM, as opposed to the EAM, which is on the outside. And then you have little openings or holes there. The first one here is a jugular foramen, and that's where we have the passage of the jugular. Is it vein or artery? Vein. Do we have a jugular artery? Okay, what feeds the brain, by the way? The carotid. Okay, so the carotid feeds the brain. The blood is returned back to the heart by way of the jugular vein. Carotid artery, jugular vein. Okay, the petrous ridge, remember, it's that jaggedy, edgy part of the petrous portion. That's at the level of the TEA. I gave you guys a reference here. TEA stands for top of the ear attachment. So the top of your ear is generally the level of those petrous ridges. Okay? The temporal bone articulates with three other bones. It articulates with the parietal on either side, the occipital on the back, and then the sphenoid right anterior to it, which is right here, the sphenoid. Of all the bones, and I'm thinking the next one is going to be the sphenoid. Of all the bones, the sphenoid bone is going to be the most complex of all the skull bones. And we'll see here why in just a little bit. So again, we're looking at it from an infero-superior view of it. There are three openings or three foramina. You have the rotundum, ovale, and the spinosum, which gives way for your different cranial nerves and arteries. I will talk a little bit later about the anterior clinoid process and then the sella turcica as well as the dorsum sellae. All these are related in the housing of the pituitary gland. And then right in back of the sella turcica is the clivus, which allows for the pons to sit on that part of the skull, is on the clivus. Now it's important up here, that's going to be on the test, is the sphenoid bone anchors all the cranial bones. It's an anchor for all the cranial bones. So it articulates with 7 cranial bones as well as 5 facial bones. See if I can get that over here now. So if we go over here and we look at the sphenoid, which is this one right here. Others. There's a lot of stuff going on with this bone.
It's ugly.
Okay. So now let's look at the next slide. You guys see the labeling on this thing? There's a lot of parts to it. Like I said, it's a very complex bone. It almost looks like, do you guys know who Rodan is? You guys ever watched the old Japanese monster movies? Rodan, the flying bird?
Did you just make it up?
Okay, never mind. You guys know Godzilla? Alright, probably way before you guys were born. Anyways. Alright, so if we start off with A. A is the superior orbital fissure. And this allows passage for the nerves and vessels related to the eyes. The superior orbital fissure, which is this area right here. Okay. Then we have B, is the anterior clinoid process. Again, it's very hard to see what's going on here with this particular slide that they posted here. But if we look at the sphenoid, okay, we're going to look at it like this. Okay. This area right here is pointing to these projections right here, these two. Okay? And then when you look at it on a lateral view, this right here, this is where the pituitary gland sits. So this anterior clinoid fossa is right here. And then you also have a anterior clinoid process, and then here you have the posterior clinoid process that you can't see in this image. So there's a lot of parts that go on with this particular bone, and it's hard to understand what they are and how they're located unless you have a skull that you hold onto, or if you've got this app. So how many? I told you guys to get this app before we did the skull, didn't we? Okay, because there's a lot of parts to it. So if you don't have the app, I highly suggest that you get it now, so you have a better understanding of the anatomy. This is two-dimensional. It's hard to identify the parts when it's two dimensions. Even if you got Fred over there, it's hard to see. Okay, we got skull phantoms in the back, but they don't come apart, so it's hard to see. So again, I highly suggest you get the app if you can. All right, now we have the optic foramen. The optic foramen gives way for the, again, it gives way for the optic nerve. The optic nerve. As well as the optic groove, it allows passage. It is a groove that the nerves and the arteries sit upon. It's kind of like a passage, a tunnel, if you will. Then we have the medial and lateral pterygoid processes. Medial and lateral pterygoid processes. Then you have the hamulus, which acts like a hammer. And all these will make sense later on because these are related to the nasal cavity when we talk about the facial bones. So we'll talk about that later on. Then again, we have the ovale and the rotundum that allows for passage of different nerves and arteries. The greater wings forms the portion of the cranial floor and the sides of the cranium. Okay. So now here's the lateral view. Okay. Here is that anterior clinoid fossa, process that we talked about earlier. And it also has a posterior. So if we go back over here, this is the anterior, and then it dips down, and right around here is where you're going to find the posterior clinoid process, which is right here, anterior and posterior, and this is where the pituitary gland sits. Okay? Right in the back of that, of where the pituitary gland sits, so you have your anterior, you have your posterior, then you have the dorsum sale. Dorsum meaning what? The back, okay? Exactly. So this is just the back of the sale. Sale just means saddle, okay? Sale, cilia turcica is the saddle that houses the pituitary gland. So this is the back wall of the cilia turcica. The clivus forms the base and support of the pons. And when we take certain x-rays, we are looking for this particular structure, the dorsum sale, that shows us that we have the correct position for one or two of the views. So that's another anatomy that we look at in critiquing our images. So we look at the sella turcica, and we're also going to look at the dorsum sale radiographically to assure that we have proper position of our x-rays. So here we have right here in the anterior posterior projection, the AP projection, the sphenoid is going to be seen through the orbits and also off to the side. Here we have a side view of it. Remember those two projections sticking down, the pterygoid processes and the hamulus? These are it right here. And what's important here is this area right here is the body of the sphenoid. And this is another area that we assess when we're doing a lateral skull or lateral sinus. It is a hollow space. That's why it's called a sinus. It's a hollow space, and that's one of the sinuses that we evaluate in our skull x-rays, is the sinuses. So again, anytime you have a sinus, air cells, all those things help make the head lighter. But we also know that it can collect fluids, it can get infected. So when you have an infection there, that's why you see people constantly doing this, okay? Because what you're squeezing here is one of your sinuses. The other one here is an ethmoid sinus. So there's a lot of pressure. When you get, if you get an infection in your mastoids, you're constantly doing this, rubbing the back of your head. Or the front of your head, your frontal sinus. Because they get infected and they collect fluid. That's one place that you can collect, where you can get an infection and also collect fluid. Okay, the ethmoid bone. Okay, very small bone. It's a very small bone. And I'm going to do this again. We can't do justice to these bones because they're two-dimensional. So if we can do 3 dimensions. So the ethmoid bone is this one right there. So if we isolate that by the others, this is what the ethmoid bone looks like. Okay. The first part that we're going to learn here is what's known as the cribiform plate. You guys have your slides in front of you? Okay. So this area right here, this is the cribiform plate with this area right here. It's a flat surface. Flat surface right here. And so if I go back to the other image here, the cribiform plate, this flat area right here, and if you look at it laterally, is this right here, is what separates the cranium from the facial bones. It separates the cranium from the facial bones. This plate right here. Okay? And it's this plate right here. The flat surface. Okay? The cribiform plate also has small openings for the olfactory nerves. Olfactory referring to what? Your sense of smell. Okay, so that's where you're going to find some nerves for your sense of smell. On the very top is the crista galli. Crista galli. And then you have this bone that goes right down the middle. Okay, this is called the perpendicular plate of the ethmoid, and it's what forms the bony nasal septum. The bony nasal septum. Go back over here. Okay. This bone is the perpendicular plate, helps form the bony nasal septum. So if I were to bring back the other structures, okay, and if I put it up, see there's that plate, that perpendicular plate that forms the bony nasal septum. This is what you're going to see on a skull x-ray, is that perpendicular plate on a skull. Okay. Alright, so that's this portion right here. So the ethmoid, then you have these masses on either side of the plate is the lateral labyrinth mass. And within the mass, if you look over here, it contains the ethmoid sinuses. It forms the medial wall of the orbits and forms the lateral wall of the nasal cavity. Okay, any questions about the ethmoid bone? No questions?
No questions.
No questions? Okay. All right, so the ethmoid bone articulates with 2 cranial bones and 11 facial bones. 2 cranial bones and 11 facial bones. All right, so let's talk about the cranial sutures. The sutures are just essentially referring to the joints of the different bones in your skull. They are fibrous joints. They are synarthrodial or immovable down here. So the first joint or the first cranial suture is the coronal, right here. This is the coronal, and it's going to separate the frontal from the parietals. So that's on the front, and if we go to the back, we have the lambdoidal suture, right here, that separates the parietals from the occipital. Then we have the squamosal, which is right here, that separates the parietals from the temporals. And then we have the intersection, where the sutures join or intersect. So on the very front, you have the bregma. On the very back, you have the lambda. The asterion is what's going to separate the squamosal and the lambdoidal, which is right around here. And in the last intersection here, we covered asterion, bregma, lambda, and then the pterion. The pterion is the intersection between the parietals, temporal, and then the greater wing of the sphenoid, right here. Now, when you're an infant, when you're young, the cranial bones aren't fully developed yet, and so you have these soft spots, or we call them fontanelles. So there are 6 of them. So the first one is the anterior and posterior. So and remember, anterior is the bregma. On the back is your lambdoidal. I'm sorry, your lambda. So these are the anterior and the posterior. Then you have the right and left sphenoid, which eventually forms the right and left pterions, right over here. And then back here, you have the right and left mastoidal, which will eventually form, or the connection of your right and left asterions. I'm kind of going slow on this. You guys already had this, right? Because I can speed it up a little bit. Or not. Okay, so here is a PA projection, also known as a Caldwell of the skull. And so remember that Christogale, if we go look back over here, the Christogale, which is this area right here, we can see it radiographically. So this is the Christogale of the ethmoid bone. What you're also going to see here is, remember that thick portion of the temporal bone which houses the organs of hearing and balance, the petrous portion. This is the petrous portion right here. And at the very edge there, these are the ridges, the petrous ridges. This triangular area over here, this is the greater wings, the shadow of the greater wings of the sphenoid bone. What else can we identify here? And then we have the suture that separates the right and left parietal. And what suture is that? Can you guys see that jaggedy edge right here? Okay, so that's the suture. So it separates the right and left. That would be your sagittal suture. Okay. And then the lambdoidal, which is back here. So what you're actually seeing here is the suture on the back side of your head, projected on the front. Okay? So if this is the suture, then what we're looking at here is the occipital projected through the front, and then your two parietals. And remember that bone that goes right down the middle here? This is the perpendicular plate of the ethmoid, right down the middle. Now, do you guys see these dark spaces right here?
Sinus.
That's one of the sinuses. That's the sinus of the ethmoid. This is your ethmoid sinuses right here. You're not going to be able to see the sphenoid sinus because it's a little bit deeper and the bones are dense.